Welcome to my channel. I'm Dr. Hampton with Lead Clinical Psychologist, Dr. Victoria Smoter with Advocate of Rural Healthcare in Chicago. And she is here to talk about 3 myths related to trauma to provide just a little clarity. And we're going to start off with myth number 1. Are trauma reactions things that last forever and are incurable? What do you say about that, Doc?
Yeah, so that is a really big question. Our brains and bodies have evolved to protect us, and a trauma response is a stress response that is a totally normal physical and emotional response to an abnormal situation. And basically, what that means is we aren't we didn't evolve to necessarily know how to manage things that we experience in modern day life. So things like, traumatic injuries, car accidents that cause injury, some of those pieces. So our brain's survival mode goes off. It can sometimes get stuck on, which is when we see those trauma responses that can turn into clinical acute stress disorder or post traumatic stress disorder. And they're not necessarily chronic or will last forever. Basically, what can happen is over time, we can learn patterns of different ways to help our brains and bodies relax. And for most people, our brains and bodies are hardwired towards resilience. So we see a lot of times the first 3 to 5 days, we feel more jumpy, more on edge. That event or that series of event might dominate our thoughts. And then over the next 3 to 5 months, 3 to 5 weeks, those initial hypervigilance symptoms tend to reduce. And then we can get back to normal even without intervention. For some of the longer standing symptoms, we can rewire our brain through wellness practices like gratitude, mindfulness, good exercise. We can actually reverse the negative effects on our brains and bodies that chronic stress level has. So there's a lot of different things that we can do. There's almost nothing in terms of a trauma response that is incurable when we think about it that way, because we're always moving towards resilience. People have that innate well-being and survival mechanism. We're all driven towards wanting to be well and feel well. And there are just some things that we can do to help our brains and bodies get there a little bit faster.
Perfect. That's very hopeful, and I'm really happy to hear you respond that way because I think a lot of people think I'm gonna have to suffer forever. So it's nice to know that you can kind of get to a point where it's not impacting your life the same way. So, well, the next myth is this ideal of, I'm strong. Particularly being a man, I know we live in a society where men are supposed to just be strong and just deal with it. So, talk a little bit about this myth that strong people can deal with trauma and don't need to get any help.
Okay, that is again really great myth. People are resilient. People are really strong. Having traumatic experiences is not something that it's not something that's supposed to happen. It's not a deficit or a sign of weakness to not know how to manage something that you haven't had to manage before. Or even if you have had to manage it before, even the strongest people, even if you think about a marathon runner, right? Even an experienced marathon runner is exhausted at the end of that 26.2 miles. They're not going to keep running. And if they had to keep running, eventually they're going to poop out and they're going to need to take a break and they're going to need to rest. So, yes, having resilience is a protective factor, being a strong person. And that doesn't mean that strong people or people who identify as being caretakers or they're always the person who is, the wall, the support for the other people in their lives don't have the same kinds of effects of long-term stress responses. It affects our bodies, it affects our brains, it affects our relationships, it affects things, and eventually we all get tired. So there are absolutely ways that people can be impacted. And just because you are impacted, it doesn't mean that anything's wrong with you. It is a normal response, like I said in our last myth, it's a normal response to an abnormal situation. And while I would like to say that every single person could benefit from therapy and from intervention, I think that's true on so many levels. Most people will be okay. Getting support, talking to people about it, having a social network, even if it's not formal mental health intervention, if it's a faith-based organization or support, having somebody that you can talk to and that you can trust is something that's helpful for every single person. You don't have to deal with it all on your own, even if you can. You don't have to.
Yeah, I think even in I serve a community of color, and sometimes getting help is looked upon in a negative way. But man, I've seen miracles work when they engage and take advantage of behavioral health professionals. So I totally agree, and I definitely want my guys to not be afraid to say I need some help. So, and speaking of guys and obviously women as well in the military. Another myth is this idea that post-traumatic stress disorder only occurs in those who were soldiers. So talk a little bit about that last myth.
Absolutely. And that's something that, we think about a lot because it's so present in pop culture of, the combat veteran who comes back and has difficulty readjusting to civilian life or has those flashbacks and nightmares. And while that is certainly one part of post-traumatic stress disorder, that's not the whole range or the whole spectrum of trauma experiences. So trauma responses can come from a lot of different things. If you have an unexpected loss of somebody, you can actually have some trauma related symptoms of traumatic grief and traumatic loss. Individuals who have experienced community based violence, who have experienced medical traumas or medical errors that result in a lack of trust or a lack of safety or a lack of felt safety. There's relational traumas, intimate partner violence, and domestic violence. There's a lot of different things that can contribute to a post-traumatic stress response presentation or that symptom. And something that I really think is important to understand is that there's also a cumulative effect of stress and trauma. So you can have that be kind of more of a slow burn, even if it's not a single event thing that has a discrete start and finish that you can point to and say, that's where this came from. Over time, being exposed to different things that cause you to feel unsafe can have a cumulative effect leading up to a PTSD type presentation.
Gotcha. And that makes a lot of sense. And obviously there's so many traumas. The trauma of COVID,
Yeah.
has been traumatic, the trauma of just being isolated. So that's very helpful. And I just really wanted to take a moment with you, an expert in the world of trauma, and just talk a little bit about these myths. So I really appreciate that. And it's nice to have a better understanding now. So guys, if you're listening to this and you enjoy what you heard from our expert today, feel free to check out podcast episode number 48, where myself and Dr. Vicky dive even deeper into the subject of trauma. So please, please, please like, subscribe, and share this video. And if there's any myths that you have or have heard about, put them in the comments and share those with anybody who will read your comments. So guys, until we meet again, make sure to be safe, be well, and continue to protect your nest. And thank you again, Doctor, for being here.